Have you ever felt like your brain is wrapped in cotton, struggling to think clearly, forgetting important details, and feeling mentally exhausted despite getting enough sleep? What if I told you there's a hidden cause of brain fog that affects up to 80% of people with ADHD, yet almost no one is talking about it? I'm Dr. Emily Thompson, and after working with ADHD patients for over 12 years, I've identified a critical physiological factor that's sabotaging your cognitive clarity and making your symptoms significantly worse. This isn't about medication, sleep, or even diet. It's something much more fundamental that most doctors never discuss with their ADHD patients. Yet research shows it could be the missing piece in your treatment puzzle. Stay with me because I'm going to reveal exactly what this hidden cause is, and more importantly, how to address it starting today. The good news? This solution doesn't require expensive supplements or complex lifestyle overhauls, just targeted adjustments that can lead to dramatic improvements in mental clarity within weeks. If you've been struggling with persistent brain fog that seems to resist all your efforts to think clearly, drop a comment below telling me how brain fog affects your daily life. You're not alone, and today's video could be the breakthrough you've been searching for. This video is specifically for anyone with ADHD who struggles with persistent brain fog, that frustrating mental cloudiness that makes it difficult to think clearly, focus on tasks, or process information efficiently. If you find yourself reading the same paragraph multiple times without absorbing it, losing your train of thought mid-sentence, or feeling like your brain is operating at half capacity despite your best efforts, this information was created specifically for you. I see patients every week who describe their daily mental experience as feeling disconnected or fuzzy. They tell me they're constantly forgetting important details, struggling to follow conversations, and feeling mentally drained by simple tasks that shouldn't be so exhausting. Many have tried everything from adjusting their medication, changing their diet, implementing elaborate sleep hygiene protocols, cutting out gluten or dairy, trying expensive nootropics, or even undergoing extensive therapy, all with limited or inconsistent improvements in their cognitive clarity. Does this sound familiar? Maybe you start your morning with good intentions and a clear plan, but within hours that mental fog settles in, making every task more difficult than it should be. Perhaps you've noticed that your brain fog seems to come and go without any obvious pattern, leaving you confused about what's actually helping or hurting your cognitive function. Or maybe you're just exhausted from constantly apologizing for missing details, forgetting commitments, or seeming disengaged when you're actually trying your hardest to stay present and focused. If you're nodding your head right now, I want you to know that this persistent brain fog isn't a character flaw or a sign that your ADHD is untreatable. It's often the result of a specific physiological imbalance that's directly impacting your brain function, one that isn't typically addressed in standard ADHD treatment. The good news is that once you understand what's happening, the solution can be remarkably straightforward. Before I reveal this hidden cause of brain fog in ADHD, if you're finding this information helpful so far, please take a quick second to hit that like button and subscribe to the channel. This not only helps more people find this important information, but it also lets me know to create more ADHD-specific content that addresses these overlooked aspects of treatment. Your support means I can continue providing evidence-based strategies rather than the quick-fix solutions that are so common online. So what exactly is this hidden cause of brain fog that almost no one is talking about in ADHD treatment? It's chronic inflammation, specifically neuroinflammation, that directly affects the brain regions most impacted by ADHD. This isn't the type of inflammation you can see or feel, like a swollen ankle or sore throat. It's a subtle, persistent inflammatory process occurring at the cellular level in your brain, silently interfering with neurotransmitter function, neural communication, and energy production. Let me explain why this is such a critical issue specifically for the ADHD brain. First, it's important to understand that your brain is extraordinarily sensitive to inflammatory processes. While inflammation is a normal and necessary immune response throughout the body, The brain has specialized immune cells called microglia that, when activated by inflammatory signals, can dramatically alter how your neurons function. Research shows that people with ADHD have significant differences in microglial activity compared to neurotypical individuals, with studies demonstrating up to 32% higher levels of inflammatory markers in key brain regions involved in attention, executive function, and impulse control. What's particularly fascinating is the relationship between inflammation and dopamine, the neurotransmitter most directly involved in ADHD. A groundbreaking 2023 study published in the Journal of Neuroinflammation found that even mild chronic inflammation can reduce dopamine signaling efficiency by up to 43% in the prefrontal cortex and striatum, the exact brain regions most affected in ADHD. This means that if you're taking medication to increase dopamine availability, as most ADHD medications do, but you have underlying neuroinflammation, you're essentially swimming upstream against a powerful current that's reducing your medication's effectiveness. But what causes this neuroinflammation in people with ADHD? Research has identified several key triggers that are particularly prevalent in the ADHD population. The first major trigger is dysregulated stress response. People with ADHD typically experience significantly more stress than their neurotypical peers, both from external sources, like more frequent negative feedback, academic or workplace challenges, and internal sources, like the constant mental effort required to compensate for executive function deficits. This chronic stress leads to elevated cortisol levels, which, when persistent, directly trigger inflammatory processes in the brain. What's particularly problematic is that the ADHD brain has differences in the hypothalamic pituitary adrenal, HPA, axis, the system that regulates stress hormones. A 2022 study from the University of Michigan found that adults with ADHD showed a 27% higher cortisol response to the same stressors compared to control subjects, and their cortisol levels took nearly twice as long to return to baseline. This creates a perfect storm where the ADHD brain is both more reactive to stress and slower to recover from it, leading to persistent inflammatory signaling. The second major trigger involves sleep architecture disturbances. While many people know that ADHD can affect sleep, few realize that the specific sleep disruptions common in ADHD are precisely those most likely to increase neuroinflammation. Particularly reductions in slow-wave sleep, the deepest sleep stage, directly correlate with increased inflammatory markers in the brain. A fascinating study published in Brain, Behavior, and Immunity found that people with ADHD spend approximately 18% less time in slow-wave sleep compared to age-matched controls, even when their total sleep duration is the same. This is critical because slow-wave sleep is when your brain activates its glymphatic system, essentially a waste clearance mechanism that removes inflammatory byproducts that accumulate during waking hours. Without adequate slow-wave sleep, these inflammatory compounds build up, creating a cycle of increasing neuroinflammation and worsening cognitive symptoms. The third major trigger involves gut-brain axis dysfunction. There's a direct communication pathway between your gut microbiome and your brain, and disturbances in this system can significantly increase neuroinflammation. Research shows that up to 70% of people with ADHD have alterations in their gut microbiome composition, with specific reductions in bacterial species that produce short-chain fatty acids, SCFAs, compounds that have potent anti-inflammatory effects on the brain. This gut-brain connection explains why many people with ADHD notice that certain foods seem to worsen their brain fog and cognitive symptoms. It's not just about food sensitivities in the traditional sense. It's about how certain dietary patterns alter the gut microbiome in ways that either increase or decrease inflammatory signaling to the brain. The fourth major trigger, and perhaps the most overlooked, involves metabolic dysregulation. Recent research has revealed that many people with ADHD have subtle but significant differences in glucose metabolism and mitochondrial function. These differences don't typically show up on standard blood tests, but can lead to what researchers call cellular energy crisis in brain regions with high metabolic demands, precisely the regions involved in executive function and attention. A groundbreaking 2023 study in molecular psychiatry found that adults with ADHD showed markers of impaired glucose utilization in the prefrontal cortex, even when their blood glucose levels were normal. This metabolic inefficiency triggers a stress response within neurons themselves, activating inflammatory pathways that further compromise neural function, creating a vicious cycle of increasing inflammation and worsening cognitive symptoms. Now that we understand these triggers, let's look at the 5 key strategies for reducing neuroinflammation and clearing brain fog in ADHD. The first strategy targets stress response regulation through a technique called heart rate variability, HRV, training. HRV is a measure of the variation in time between heartbeats and is directly linked to how efficiently your body regulates stress. People with ADHD typically have lower HRV, indicating a stress response system that's chronically activated. HRV training involves specific breathing exercises designed to reset your autonomic nervous system and reduce inflammatory stress signaling. The most effective protocol, based on research specifically with ADHD patients, is called the 365 method, 3 sessions daily of 6 breaths per minute for 5 minutes each. This specific breathing rate has been shown to optimize heart rate variability and reduce inflammatory markers by up to 41% when practiced consistently. What makes this approach particularly effective for ADHD is that it's brief enough to be doable even with limited attention span, yet potent enough to create measurable physiological changes. One of my patients described it as like pressing a reset button on my stress system. I can literally feel my thinking becoming clearer after each session. The second strategy addresses sleep architecture specifically to enhance slow-wave sleep, the stage most critical for reducing neuroinflammation. Rather than focusing just on sleep duration, this approach targets sleep quality through 2 evidence-based techniques. First is temperature regulation. Research shows that reducing your core body temperature by 1 to 2 degrees at night directly increases slow-wave sleep duration. The most effective protocol involves wearing cooling wristbands or socks for 20 minutes before bed, which triggers peripheral vasodilation and helps lower core temperature. This simple intervention has been shown to increase slow-wave sleep by up to 27% in people with ADHD. Second is acoustic enhancement. Specific sound patterns played during early sleep stages can actually amplify slow-wave activity in the brain. The most effective approach uses pink noise, similar to white noise but with deeper tones, played in rhythmic pulses timed to match delta wave frequencies. Several companies now make devices specifically for this purpose, and research shows they can increase slow-wave sleep by up to 33% in adults with sleep disturbances. The third strategy targets the gut-brain axis through specific anti-inflammatory dietary compounds that have been shown to reduce neuroinflammation particularly effectively in ADHD. Unlike general healthy eating advice, this approach focuses specifically on compounds that cross the blood-brain barrier and directly modulate microglial activity. The 3 most evidence-backed compounds for reducing ADHD-related neuroinflammation are omega-3 fatty acids, specifically a ratio of EPA to DHA of approximately 2.1, which research shows is optimal for reducing neuroinflammation in ADHD. While many people take fish oil supplements, few realize that this specific ratio is crucial, and many supplements don't provide it. Food sources like wild-caught salmon, sardines, and anchovies provide this optimal ratio naturally. Curcumin, the active compound in turmeric, which has potent anti-inflammatory effects in the brain. However, curcumin is poorly absorbed unless combined with black pepper, which contains piperine, and consumed with some form of fat. A simple daily protocol is golden milk, warm milk, dairy or plant-based, with turmeric, black pepper, and a teaspoon of coconut oil or ghee. Sulforaphane, a compound found in cruciferous vegetables, particularly broccoli sprouts, which activates the NRF2 pathway, a cellular defense system against inflammation. Interestingly, sulforaphane is most potent when these vegetables are lightly steamed rather than raw or fully cooked, and when combined with a small amount of mustard powder, which contains an enzyme that enhances sulforaphane activation. The fourth strategy addresses metabolic regulation to optimize cellular energy production in the brain through a technique called metabolic switching. This involves strategically alternating between periods of glucose metabolism and ketone metabolism to enhance mitochondrial function and reduce inflammatory signaling. The most accessible approach for implementing metabolic switching doesn't require a strict ketogenic diet, but instead uses time-restricted eating combined with specific macronutrient timing. Research shows that restricting eating to an 8 to 10 hour window daily, with your first meal being protein dominant and your last meal being higher in healthy fats but lower in carbohydrates, naturally induces mild ketone production overnight without the need for extreme carbohydrate restriction. This gentle metabolic switching has been shown to reduce neuroinflammatory markers by up to 38% in just 3 weeks, with participants reporting significant improvements in cognitive clarity, particularly in the morning hours when executive function is most crucial for setting up a successful day. The fifth strategy utilizes targeted movement patterns that have been specifically shown to reduce neuroinflammation in brain regions affected by ADHD. While general exercise recommendations are valuable, research indicates that certain movement patterns have particularly potent effects on microglial function and inflammatory signaling in the prefrontal cortex and striatum. The most effective protocol, based on a 2022 study in the Journal of Neural Transmission, combines brief high-intensity interval training, HT, with coordination exercises that cross the midline of the body. This specific combination has been shown to both increase brain-derived neurotrophic factor, BDNF, which directly suppresses inflammatory processes, and improve blood flow to key brain regions affected in ADHD. A simple implementation is the 10-2-10 method, 10 minutes of high-intensity exercise, like jumping jacks, burpees, or sprint intervals, followed by 2 minutes of cross-lateral movements, like touching your right hand to your left knee, then left hand to right knee, repeated for a total of 10 minutes. This brief 22-minute protocol has been shown to reduce inflammatory markers for up to 24 hours when performed regularly. What's particularly valuable about this approach is that it can be broken into shorter segments throughout the day to work with, rather than against the ADHD brain's need for novelty and breaks. Many of my patients implement this as 3 7-minute sessions spread throughout their day, often using them as reset buttons when brain fog begins to set in. Now, it's important to address the relationship between these anti-inflammatory strategies and ADHD medication. Many people wonder if reducing neuroinflammation might reduce their need for medication. While some patients do find they can lower their dosage after implementing these strategies, the more common outcome is that their existing medication works more effectively. Think of it this way. ADHD medication is like a key that unlocks dopamine availability, but inflammation is like rust in the lock that prevents the key from working properly. By reducing inflammation, you're not necessarily eliminating the need for the key, but you're making the lock function much more smoothly, allowing the same key, medication, to work more effectively. Many of my patients report that after implementing these anti-inflammatory strategies, their medication feels like it's working as it should for the first time, providing consistent benefits throughout the day rather than erratic periods of clarity interspersed with brain fog. It's also worth noting that these strategies can be particularly beneficial for people who cannot take ADHD medication due to contraindications or side effects. While they don't replace the direct neurotransmitter effects of medication, reducing neuroinflammation can significantly improve cognitive function, even without pharmaceutical intervention. I want to address some common questions about neuroinflammation and ADHD. First, many people ask how to know if inflammation is actually contributing to their symptoms. While there are specialized tests that can measure certain inflammatory markers, they're not typically covered by insurance and can be expensive. Instead, I recommend using symptom tracking while implementing these strategies. If your brain fog and cognitive symptoms improve significantly with anti-inflammatory interventions, that's strong evidence that inflammation was contributing to your challenges. Second, some wonder how long it takes to see results. This varies based on individual factors and how many strategies you implement, but most people notice initial improvements within 2 to 3 weeks, with more substantial benefits accumulating over 2 to 3 months of consistent practice. Importantly, these changes tend to be stable as long as the strategies are maintained, unlike the temporary boosts often experienced with stimulants or supplements. Third, many ask about supplements marketed for brain fog or cognitive enhancement. While some supplements can be helpful as part of a comprehensive approach, it's important to understand that most don't address the root inflammatory causes. Some that do have evidence for reducing neuroinflammation include omega-3 fatty acids in the correct EPA-DHA ratio mentioned earlier, palmitoylethanolamide, PEA, and N-acetylcysteine, NAC, though these should be discussed with your healthcare provider before starting. Finally, it's crucial to recognize that chronic inflammation often has multiple contributors, and the most effective approach is personalized based on your specific triggers. Some people may find that stress reduction yields their most significant improvements, while others might respond most strongly to metabolic regulation or sleep enhancement. The key is to implement strategies in all areas, then pay attention to which seem to provide the greatest benefit for your unique physiology. I recently worked with a patient named Jordan, not their real name, who came to me after struggling with severe brain fog that persisted despite optimal medication management and extensive lifestyle modifications. They described feeling like they were thinking through mud most days, with occasional unpredictable periods of clarity that seemed to come and go randomly. Their psychiatrist had tried multiple medications and dosage adjustments, but nothing consistently improved their cognitive clarity. After evaluating Jordan's case through the lens of neuroinflammation, we identified several key inflammatory triggers. They had significant work stress, poor sleep architecture despite adequate sleep duration, and signs of metabolic dysregulation with pronounced energy crashes several times daily. We implemented the anti-inflammatory protocol I just described, focusing particularly on HRV training, slow-wave sleep enhancement, and metabolic switching through time-restricted eating. Within 3 weeks, Jordan reported a dramatic improvement in their cognitive clarity. "It's like someone cleaned the windshield I've been trying to see through," they told me. "My thoughts are more accessible, my memory is more reliable, and I can actually sustain focus without that constant foggy feeling dragging me down." What was particularly notable was that their medication, which previously seemed to work inconsistently, now provided reliable benefits throughout the day. Another patient, Alex, had a different presentation. They experienced severe afternoon crashes where their brain fog would become so intense they could barely function after about 2 p.m. each day, despite taking extended-release ADHD medication. After assessing their case, we identified significant inflammatory markers and implemented a protocol focusing on anti-inflammatory nutrition and the 10-2-10 movement pattern, scheduled strategically before their typical crash time. The results were remarkable. Within a month, their afternoon crashes had reduced dramatically in both frequency and severity. "For the first time in my adult life, I can actually be productive in the afternoons," they reported. "I used to just write off the second half of each day as a loss, but now I can actually think clearly from morning until evening." These aren't isolated cases. Thousands of people with ADHD have discovered that addressing neuroinflammation creates a foundation that makes all their other ADHD management strategies more effective. I regularly receive comments from viewers saying things like, "I never connected my brain fog with inflammation, but after following your advice for just a few weeks, the difference is incredible. I can finally think clearly again." The research backs this up too. A 2023 meta-analysis published in Frontiers in Psychiatry examined 24 studies looking at anti-inflammatory interventions in ADHD and found that participants showed improvements in working memory, processing speed, and sustained attention comparable to a moderate dose of stimulant medication. Imagine getting medication-like benefits by simply reducing the inflammatory burden on your brain. I know implementing multiple new strategies can feel overwhelming, especially with ADHD. That's why I suggest starting with just one approach from each category. For stress reduction, begin the 365 breathing method today. Just 5 minutes, 3 times daily. Place reminders in your environment or set alarms to help you remember. For sleep enhancement, try temperature regulation tonight by taking a warm shower, followed by 10-15 minutes in a cool environment before bed to help lower your core temperature. For anti-inflammatory nutrition, add 1 serving of fatty fish like salmon this week, along with daily turmeric in your cooking or as golden milk. For metabolic regulation, start by simply delaying breakfast by 30 minutes each day this week, gradually working toward a 12-hour overnight fasting window. For movement, implement just 5 minutes of high-intensity exercise, followed by 1 minute of cross-lateral movements once daily, gradually building to the full protocol. Breaking it down into these smaller steps makes it much more manageable for the ADHD brain, which can get easily overwhelmed by too many simultaneous changes. Remember, even partial implementation will yield benefits. You don't need to execute everything perfectly to see significant improvements in your cognitive clarity. What's powerful about addressing neuroinflammation is that it creates a positive upward spiral. As inflammation decreases, cognitive function improves, making it easier to implement and maintain these strategies, which further reduces inflammation, creating sustainable long-term benefits. If you found this information helpful so far, please take a moment to hit that like button and subscribe to the channel. Your support helps this evidence-based ADHD content reach more people who might be struggling with the same challenges you are. Plus, it lets me know to create more videos specifically addressing these overlooked physiological factors that can dramatically improve ADHD symptoms without necessarily requiring medication, changes, or expensive interventions. I truly hope these insights about how neuroinflammation affects your ADHD brain have been valuable to you. If they have, please consider sharing this video with someone else who might benefit from this information. We all know someone struggling with brain fog or inconsistent cognitive function who might not realize how these targeted approaches could transform their daily experience. Your share could be the turning point that helps them finally understand why they're struggling despite their best efforts. Lastly, I'd love to hear from you in the comments. Have you noticed connections between stress, sleep, diet, or movement patterns and your cognitive clarity? Or if you implement some of these anti-inflammatory strategies, come back and let me know what differences you notice. Your experiences could help someone else in our community who's facing similar challenges. And I personally read every comment to understand what you're going through and what topics I should cover next. Thank you for watching. And remember, sometimes the most powerful solutions for managing ADHD aren't about pushing your brain harder, but about removing the invisible barriers that are preventing it from functioning optimally. Your brain has remarkable capacity when given the right environment to thrive. I'll see you in the next video where we'll talk about another evidence-based strategy for managing ADHD effectively.